Okay, so we have here an activity regarding the chemical examination of our urine sample for the protein determination. So this experiment would allow us to determine the presence of the protein in our urine sample not by your method here with the use of your reagent strip, but by the use of our chemical reagents. So this is a wet method for the chemical examination. Okay, so the principle of this test here would be protein in our urine sample is being precipitated by addition of your acid, or even by administration of your heat. So the heat or even the acid try to precipitate the protein in our urine sample, and the amount of the precipitate or the turbidity after addition of your acid or by heating your sample would tend to be associated here with the amount of the protein present in our urine sample. Okay, so usually the urine sample contains as small as 10 mg per dl or less than 100 grams per d of the protein. And that is because of the small molecular weight protein that in the form of your microglobulin, thumb horsepower protein, or even your albumin. Or it might also be because of the protein that might add in the urine sample as the urine try to pass through here in the lower genitourinary tract. But other than that, normally we are negative for the protein in the urine sample. Okay, because again, protein is a large molecular weight substances or molecular size substances, and therefore it should not be filtered by our glomerulus. So clinical proteinuria, would occur here, we considered if the urine protein that we are excreting in our body would be more than 30 mg per dl or more than 300 grams per day. Okay, and proteinuria is the most indicative of the kidney problem. So pag nag-test tayo ng protein ni patient, pag may protein or like say positive ang patient natin sa protein, so that's related to the renal problem. So nakakatakot siya. Okay, we have here the different method for the chemical examination of our protein, urine protein. The first one, we have here the SSA or the sulfosalicylic acid test. Okay, so again, the principle of this one is based on the precipitation of our protein by addition of our sulfosalicylic acid by which is an acid. Procedure for this one, number one, okay, you try to put here 2 ml of the urine sample in a test tube and try to acidify your urine sample. So, by doing that one, first you need to check for the pH of the urine. So, like if the urine pH here is alkaline, then we need to acidify that one. How are you going to check for the pH? You can use your litmus paper, or you can also use your reagent strip to test here for the pH. We need to acidify because again, pag alkaline kasi ang reagent natin is an acid. So pag alkaline ang urine sample natin, so pag nag-add tayo ng acid, it will not it will result here to your false negative result. Therefore, dapat acidify na ating urine. We can acidify our urine here by addition of your drop by drop ng glacial acetic acid. So, 1 drop, meaning to say, kukuha ka ng urine sample, mag-add ka ng glacial acetic acid, tapos i-test mo until na maging acidic ang urine sample. Once acidified, proceed here with the examination. So, just be needing only here 2 ml of your urine sample, acidified urine sample. You try to put that one in your test tube. Then you add your equal volume of your 20% na SSA. So, mean to say 2 ml then na SSA. Then, cover your tube, okay, by a parafilm. Do not, cover by your thumb when you are inverting that one because acid ito. So, baka masunog ang skin natin. So, you could cover here with your parafilm, or you could also cover that one with your rubber stopper. Okay, and then try to invert. That would allow here the entire sample solution here to be mixed completely. Then allow it to stay at room temperature for 10 minutes. Then after 10 minutes, you try to observe here for the turbidity and try to report. So how would you going to report your result? Okay, we have here the way of reporting for the results. So, negative. Okay, so wala kang makikitang turbidity or cloudiness. Trace, you have here noticeable turbidity but wala siyang granulation or the flocculation. 1 plus, you have more distinct na turbidity. Pero again, wala ka pa din granulation or the flocculation. 2 plus would have here turbidity with the granulation pero walang flocculation. 3 plus turbidity, meron ka ng granulation, meron ka pang flocculation. And 4 plus, sobrang clump na, sobrang buo-buo na ang ating protein. Okay, that's your 4 plus. Okay, so pag nagsulat tayo ng result nito, first, we need to report here the observation. Pag sinabing observation, so ito ang isulat natin, the narrative description ng result natin. And for your interpretation, ito, negative trace 1 plus, 2 plus, 3 plus, or 4 plus. That's why you're going to write with your interpretation. Pag nagsulat tayo ng negative, dapat buong negative na word, not the minus sign. Kaya usually, di ba, pag nagsulat tayo ng negative, di ba, ganun siya. Okay, but when you are reporting for the result, dapat hindi ganito. You should write the entire word na negative. Okay, then another method for your protein termination, we have here your heat and your acetic acid tests. So this based on principle here that when your albumin, phosphate, carbonates are present in the urine sample, upon heating, okay, it will produce here turbid na solution. But upon addition of your glacial acetic acid, if ang present natin, kasi pag nagkaroon ng turbid after your heating process, so lahat sila, okay, will be the reason for the turbidity. And we don't know which of them is exactly the one present in the urine sample. To differentiate the three, then we will add here your acetic acid. So upon addition of your acetic acid, if one is present in albumin, so ang turbidity natin, it try to persist, mean to say, mas lalo siya maging turbid, andun pa din ang turbidity natin. But what if present here would be the phosphate or the carbonate? Upon addition of your glacial acetic acid, it will disappear. Mean to say, pag hit mo kanina, turbid ang solution. Pag nag-add ka ng acetic acid, naging clear ang ating solution. So, you might suspect for the phosphate or the carbonate. Paano natin ma-identify if that one is a phosphate or this one is carbonate? Kasi pareho naman sila nag-clear ang kanyang solution. So, try to observe here, pag add natin ng glacial acetic acid, pag nawala siya, then nagkaroon ng effervescence. Pag sabing effervescence, parang bubble formation, then nawala, then nag-disappear ang turbidity, naging clear ang solution, then that's your carbonate. So pag phosphate, wala siyang bubble formation upon addition of your glacial acetic acid, naging clear siya. But walang effervescence or the bubble formation, so what is present is your phosphate. Okay, procedure for this one. Okay, so try to transfer 3/4 volume the urine sample in the test tube. Then try to heat, okay, the upper portion of the mouth of your test tube. Okay, kung ito ang test tube natin, okay, with your test tube holder, okay, i-hit mo dito lang na portion sa taas. Okay, with your flame, okay, so magitong flame, i-hit mo dito na part. Okay, then after that one, pag nakita tayo, wait until na nag-boil siya, then you stop heating. Then after that one, try to observe here for the turbidity. Pag after heating, walang turbidity, then that's automatic. We report negative na result. Pero pag nagkaroon ng turbidity, then you still need to proceed here. Okay, by addition of your 1 to 3 drops of your 10% glacial acetic acid. Then try to observe kung nawala or andun pa din ang turbidity natin. Based on that, okay, try to report as positive for albumin, positive for phosphate, or positive for your carbonate. If positive, kung nagkaroon ng turbidity. Then you report negative kung wala namang turbidity. Okay, so that's it for your chemical examination for your urine protein.